Good evening. Are we recording?
Sorry about that.
Good evening and welcome to this regular meeting of the Helotes City Council. It's July 23rd, 2020, and we're underway at 7 p.m. I'd like to welcome everybody tonight, and we will get started. First up on our agenda is our invocation, and tonight Councilmember Holmes will take care of the invocation and do that honor for us, and then we'll have the Pledge of Allegiance to the United States and Texas flags. Will you please stand for that invocation and pledges?
Our God, our Father on high, we stand in your presence with thanksgiving that we have been entrusted by the citizens of Helotes to administer the business of the city. We ask that you provide us your wisdom and your knowledge to do that which is right, just, and honorable in your sight. Father, in these troubling and uncertain times, both in the current pandemic and the lawlessness in our streets, help us to turn to you for comfort, guidance, and understanding. Grant us solace in the fact that as dire as things may seem, you are still in control and you are still on your throne. We ask that you provide special watch care over our servicemen and women around the world, our city, our emergency responders, our healthcare workers, and over us and our families. Forgive us where we fail you, and help us to forgive those that do wrong. In the name of Jesus Christ, we ask these things. Amen.
Amen. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state under God, one and indivisible.
Okay, next up we have public hearing. I'll open the public hearing and read it, and then we'll see if we have anybody that signed up to speak. This public hearing is to give all interested persons the right to appear and be heard on a request by Cross Development, SF San Antonio Bandera LLC for a preliminary and final replat, establishing the Service First, Helotes lots 3 and 4, Block 1, previously platted as BBVA Compass Bank, Lot 1, Block 1, more particularly described as BCAD property ID number 1273906. And I forgot to get the time. It was about 7:02 when we opened that public hearing. We have no one signed up to speak. No one signed up to speak. So we opened it at 7:02. We'll close it at 7:03. Next up, we have a second public hearing. We'll open this one at 7:03. And this public hearing is to give all interested persons the right to appear and be heard on a request by Versatera Development for a preliminary and final replat establishing Bandera Oaks subdivision lots 9 through 30, 902, 903, and 999, Block 2, previously platted as Bandera Oaks lot 7 and 901, Block 2, more particularly described as Bexar County Appraisal District property ID numbers 1308636 and 1308638. And no one signed up for this one either. So we will close this public hearing at 7:04. And then we have citizens to be heard. Do we have anyone call in?
We had somebody sign up, but I don't believe that she has called in. Shayna Braswell, are you on the line?
Nope.
She did not call in.
Okay. Well, we have our written comments that each one of you should have in front of you.
I only made a copy for you.
Oh, you only made a copy for me? Oh, okay. Well, if y'all are interested, you can look at my copy.
Was that the copy of, sir?
Hmm?
Was that the copy of what she was going to say?
Yeah.
Okay, thank you.
So we'll pass it around.
Yes.
And I guess if y'all want a copy, we can
I can email it.
just email it to him, yeah, forward it to him. Okay, next up, we have our consent agenda, items 5 through 7. The consent agenda in our form of meeting here is just a grouping together of items that the staff and I consider to be fairly routine city business, and typically they're approved or in a group. And tonight we have items 5 through 7. However, if a council member would like to ask a question about one or have one pulled for individual discussion, that's their right to do. Otherwise, I would, if there are no questions, any questions? All right, no request to pull. Then I would ask for a motion and a second to approve consent agenda items 5 through 7.
Mayor, I make a motion we approve consent agenda items 5 through 7.
We have a motion from Byes. Do we have a second?
Second.
Second from Fredericks. So again, no discussion required. We'll call the question. All in favor of approving consent agenda items 5 through 7, respond by saying aye.
Aye.
Opposed, say no. Motion carries unanimously. Items 5 through 7 on the consent agenda are approved. Next up, we have our items for individual consideration. Number 8, discussion of an action on extending the animal care services agreement between the City of Helotes and De Zavala Chavano Veterinary Clinic for a 1-year period commencing on September 1, 2020 and terminating on August 31st, 2021. So if we could have a motion and a second to discuss and take action on item 8, please.
Mayor, make a motion we discuss that action on 8.
We have a motion from Byes. We have a second.
I'll second.
Second from Holmes. Okay, Bert, it's your motion.
If I remember right, well, first of all, I've noticed some of the fees have gone up a little bit, seems like to me, and that's to be expected. Also, if I remember right, Dustin used to say that isn't it kind of hard finding some place to do this service?
Yes.
And okay, so I'm thinking that it'd be good to extend the contract. That's all I had.
Okay, Alan?
I assume I haven't been here, as you know, through the past year, but we're satisfied with the services. No complaints.
Yes. Anything else?
That's it.
Alex?
No, I'm fine with it. Thank you, sir.
Cynthia?
I was just wondering how much we have spent on this from the past year. Do you know?
Not a whole lot. Marion, did you get those
I did.
answers to the questions?
In the past years, in 2019, we spent $2,094, and this year so far, $1,292.
Okay, that's fine.
And did you get my email today about that?
Yep.
Was I?
No, actually, the way it happens is when we intake an animal, we try to find, if it looks like it has an owner, we have microchip, we try to find the owner itself.
Right.
If there's nothing wrong with it. If there is something wrong, health-wise, it goes to them. If it looks like it was a stray, it goes to the Humane Society. So it just depends on if we feel like it's a stray or if an owner can be found, and if there's needs of some kind of medical care or something on these animals. Now, all cats go directly to the Humane Society.
Cats where?
Cats go to the Humane Society.
Okay. And if we do find the owner and the animal's already over there, the owner's responsible for the charges.
Right, but they actually come to us first.
Yes.
To pay for all, because there's extra fees involved. They come to us, pay, and then they need to provide a receipt to the animal, to the Zavala shelter clinic, so Chavano Clinic, to show that they paid the fees to the city.
Okay, thanks. Anything else, Cynthia?
Yeah.
Paul?
Then that was one question that I had. So there is a fee for the citizen if we transport their animal over there that goes to the city? I
Yes.
understand that they collect their fee, but
No, they don't
we
even
get a-
collect, they don't even collect their fee. Everything is, for that animal, everything is given to us what that total charge is for that animal. And then we add, there is an extra fee for, because we pick them up and so forth, and then any additional cost of, if there was some kind of medical need or something like that, then that, at that point, that's added to the whole bill, and then the citizen, the resident citizen, whoever the owner is, picks it up and then takes that receipt. And then we actually pay the clinic. So there's no transaction between the owner and the clinic. It's all through the city.
Yeah, I had several questions, and Mary sent me quite a bit of information, but, I mean, they do seem to do a good job of getting the animals back to the owner as much as they can. And
They do.
there's not a lot of animals that really go to the animal hospital, really.
No, we have more that actually go to the Humane
Yeah.
Society than we do to the actual
And we pay
clinic.
them a fee?
We do pay them a fee, I have that, they're flat rate fees, and, but the thing is at that point, we don't get reimbursed for those, but for cats, it's $96 per animal surrender. For puppies 4 months of age and under, it's 102. Dogs, 4 months of age and over that are 80 pounds, it's 120, and then over 81 pounds is, under 80 pounds is 120, over 81 is 125.
And we do have the facilities here under the shed and in Public Works building to keep dogs and cats for a particular amount of time, trying to locate the owner.
Yeah.
And then we take them to either the Humane Society or Days of Wild if we don't find the owner.
Correct.
Do y'all look at do you mind if I ask a quick question? Do you all look at online, when an animal comes in?
We did before, and then that was one of the things that I actually, Justin and our public relations is working on, doing an online type page. But we are putting them on at least our social media, so that we can say, hey, we picked up this dog or cat. If we can't find the owner within so many days, we send that out to see if maybe an owner follows us on social media, and it's like, oh, okay, that's where my animal is, and so forth. Especially if they're chipped, then we already have their information.
Yeah, we have
So
the
once-
ability to scan the chips.
Thank you.
Perfect, thank you.
Okay,
That's all.
Bert, anything else?
No.
Alan?
No.
Alex, anything else?
No, sir.
You guys are good? Okay, no further discussion, we'll call the question. All in favor of approving item 8, say aye.
Aye.
Opposed, say no. Motion carries. Item 9 is discussion of an action on a resolution of the City Council of the City of Helotes approving a professional services agreement between the City of Helotes and Emergicon LLC for the billing and collection services of EMS fees for a 3-year period commencing on October 1, 2020 and terminating September 30th, 2023. And got Chief Moreland here. He's the one that brought this to us. So Chief, you want to come up and just quickly give a summary of why we're doing this and make it clear to the council, and then we'll get into discussion and action.
Sure. Mayor and council, we've been looking at our billing process and the performance of our current billing company since the summer of 2018. And we made a few changes over the year, a couple of years during that period. We actually sent one of our paramedics last spring of 19 to a certified ambulance documentation specialist class. He came back and taught all of our people on some of the nuances and some of the changes that take place in the insurance billing industry, specifically for EMS. And we did get some compliments from our billing company on how over the course of about 8 months, things got better for us. But we're still seeing performance that we weren't really satisfied with. So we started doing a little shopping around, started doing a little research, and we found that we were confident that Emergicon could actually benefit us by providing us with about 24% more over the course of a fiscal year in revenue than what we've been getting. The goal is in EMS is to try to get as close to breaking even as you can, but you never do, especially in 911 provision. But at least we can get a little bit more of what we're entitled to from insurance, Medicare, so on and so forth, than we have been getting. Right now, our payer mix under our current configuration is about 74% of insured patients, which is actually a pretty good number for anywhere in the country. Most affluent communities are somewhere between 70 and 80% of coverage. If you go further south, down into the valley or along the Gulf Coast, you'll be lucky to have 20 to 25% of people actually covered by medical insurance or Medicare. It's almost directly inverse the further south we go in Medicaid patients as opposed to Medicare patients. Medicaid pays at a much, much lower rate than Medicare. We're fortunate in that our community here, we don't have a lot of small children, we don't have really any kind of low-income situations that prompt people to have have Medicaid as their primary provider. So we see this as an opportunity to not only kind of shore up some of our loose ends, but at the same time change the process and increase our overall revenues by almost a quarter. So I can entertain any questions you guys may have.
Have a motion from Massey. Do we have a second?
I'll second.
And a second from Bias. Okay, Cynthia?
My question is, as you said, so 75% have insurance. So are they gonna be going after the 25% who don't? Is that what we're talking about?
No, this is overall. Everyone gets a bill, regardless of what type of insurance they have, or if they don't have insurance at all. That 75% or 74.8%, it fluctuates throughout the course of the year. I mean, some months we may have 90% of the people that we deal with have insurance. And some months it may drop as low as 60%. So it fluctuates. But on average, it's about 74.8%, I think, which is actually a really good number for us. Now, it's not that they don't have insurance, it's that they have the means to provide the insurance. It being that 74.8% is primarily Medicare, which pretty much pays 100% of an ambulance bill to a degree, or private insurance.
So my question was, this company is gonna try to recoup money that we should be getting, right?
Yes.
Okay, so how are they doing this? For people without insurance? How do
They get a bill and they're expected to pay it,
whether they have insurance or not?
whether they have
right?
insurance or not. Now, the
So-
majority of all of our patients that we carry, the bill goes to their insurance company and they
And
rarely
that's-
see anything directly from us or from our
So
billing.
so they're gonna be going after the people who are not paying?
That's part of it as well.
Okay.
And keep in mind that that's what we've been doing for a number of years, but with a different company.
Yeah.
This new company charges a lesser fee and had a couple other features that it was above and beyond the other one. Did you want to cover that?
Yeah, the new company, essentially they do everything that the company that we've used since 2011 does, with a few extra little twists. First off, at the end of the day, when they get a payment, or at the end of the month, when they get all the payments in, currently we pay 10.5% of the gross monthly intake. Under this new company, they propose 7% of the gross monthly intake, which is a significant chunk. The other part of that is that this new company is strictly online, so we won't have to send emails back and forth trying to figure out this or that or make phone calls. Everything that we need to track a patient or to track records is available to us at the push of a button. So they're a little more streamlined in the way that they do business.
Right, so basically it's the added features and the lower, for lack of a better term, fee or commission, going from 10.5% to 7%.
Yes, sir.
Okay. Anything else? Bert?
No, that's excellent. I know 74% is nowhere near what San Antonio collects, not even close.
So be lucky to hit 30.
Right, right, and reducing it also, you did a good job, Chief. That's all I
Okay. Alan?
Chief, again, I think you did a great job also, and I'm pleased that that number and the savings are going to emerging economy from our former provider.
Well, let's just hope at the end of the next fiscal year I'm right.
I'm sure he will be.
Alex?
I don't have any questions that haven't already been answered, thank you.
Okay, Paul?
So how is the reimbursement compared to the actual cost of the service?
It's dependent on the type of coverage that most people have. If it's Medicare Part A, it's usually close to 100%. If it's private insurance, it's usually close to 100%. Although, you know as well as I do, with insurance companies, it's like pulling teeth to get that close to 100% out of them at the end of the day.
It's negotiated, right?
You have to negotiate a little bit, and you have to kind of know what they're looking for in a lot of things. And you know, the main thing about it is it's how we document, and that's part of the reason that we sent our guy to the documentation school so that he can come back, tell everybody where we're missing some things. And this company also provides those types of classes for our people throughout their tenure with us. So we'll stay on top of it and make whatever changes that are necessary. Unfortunately, EMS billing, like most insurance, every year or two, they change a word that they want to see in a report. One word can send you to, can make the difference between getting paid or sending it to another department in the insurance company and delaying it. Eventually you get paid, but it's delay after delay after delay.
How far away is your reimbursement? So if you transport somebody today, when is your reimbursement for that?
Again, it depends on the insurance. Medicare is pretty good about somewhere between 45 and 60 days from start to finish. Private insurance, I've seen it go as long as 90 days, sometimes a little longer. And then I've got a list of 180-day and older accounts that it just grows. But we try to track those as closely as we can.
This is going to be a time saver for your guys
Oh,
also
yeah.
with the
Yeah.
streamlined process?
Actually, the guys in the field won't even notice anything's changed. But for our executive secretary, it's gonna take a load off of her desk.
Will Emergicon pursue the ones that are long overdue?
Yes, to a degree. From what I understand, from what I've been told, even Medicare, if it's something that's older than about a year and a half, they will write it off themselves.
Yeah, I'm thinking, you mentioned 6 months, so 6 months to a year.
6 months to a year.
I know on warrants, we have some that are really old.
Oh, yeah.
That we still go after, even though the collection rate is very low.
Yeah.
So
There's,
here-
right now, we've got some ambulance bills that are pushing, I want to say 6 years old.
Okay.
A lot of those are people with no insurance as well. But some of them are insurance companies that have put us off that long.
Okay. Cynthia, anything else?
No.
Bert, any follow-up?
No, sir.
Alan?
Nope.
Alex, nothing
No,
you need?
thank you.
Oh, you're good?
Thank you.
Okay. No further discussion being necessary, we'll call the question.
Thank you.
All in favor of approving the resolution and for moving to a professional services agreement between us and Emergicon LLC, say aye.
Aye.
Opposed, say no. Motion carries. Next up is item 10, presentation by firm representatives, discussion of and action on selection of an insurance broker to provide employee benefit services to the city of Helotes for fiscal year end 2021 and beyond. So, let's go ahead and have the presentations. You have Crandall set up first? Okay. And Crandall and Associates is our current provider, and they have been for 25 years. And we'll hear from them first.
Hello, can y'all hear me?
Yes.
Hi,
Yeah,
good evening, Council here. I undid my video, but it's not maybe there. Oh, there we go. Hello, I'm Shirley Crandall with Crandall and Associates Insurance Agency, and thank you for having us this evening. I've got Barbie Patterson with us also, and Michelle Burnett, and Warren Culp. So I understand y'all have a copy of the presentation. I know that the city council is the same city council except for one person. When we presented 5 years ago, I just don't want to be redundant, but if you want us to review it, I'll be happy to do that. Or if you want to just ask any questions, how would you like for me to just...
Yeah, give us a refresher, Shirley.
Okay, great. So, thank you again. As the mayor mentioned, we've been your agent back in the Judy Hinkle days. Since 1995, I originally wrote your account, and she left us for 1 year, and then 9 months later, she came back and said, please help us. We want to come back. So we were glad to hear that, and we sincerely appreciate your business. And have for 25 years. Can you do the next slide, Barbie, please? So just a little bit about our agency. We've been in business since 1987. And we started off offering employee benefits. I had worked for an insurance company for 4 years prior, and left that company because we offered only self-funded, and this was in the middle 80s, oil crunch, housing resolution trust, and so I said, hey, can we come up with some other products, because our clients were losing employees, and he said no, and I said, okay. So that's when I learned if you don't keep up with change will pass you up. So I started Crandall and Associates in '87 doing employee benefits, and then we diversified in '95 the agency to offer commercial insurance also for businesses, as they were asking us to, because it's easier to deal with one agent. And just for a note, I know we're not talking commercial insurance, but we have some great programs for municipalities for their commercial insurance also. Next slide. There we go. So that's just a little bit about me. I've got over 37 years experience, 33 at Crandall and Associates, and I have licenses to sell the employee benefits and the commercial insurance. And here's Barbie. Whoops, where went Barbie? There's Barbie. She's got 30 years of employee benefit experience, both on the employer side and the agency side. And she has a license to sell both also, employee benefits and commercial insurance. And she has her certification for small group specialist. And then we have Michelle Burnett, who's been with us, or been in the business for 20 years, and she's been with Crandall approximately 10 years. And she handles, she's another one of our account managers, and she's also a certified small group specialist. And then we have Lauren Culp, who's our newest, well, no, Janet, or second to the newest. She's got 7 years of employee benefits experience, and she's licensed in both, and is studying to get her certified employee benefit specialist, and has 2 classes left to finish. And then Jenna, our other account manager. Jana's been with us, I think, 3.5, close to 4 years, and she's one of our account managers. She's got experience both in self-funded and fully insured, and she's licensed to sell employee benefits. And she also does Medicare plans. So just some of the services. Basically what agents do is they come in, they review your plan, we send out a request for proposals every year to obtain options to make sure that we're providing our clients the most competitive plan options with the most enhanced benefits. We also used to, I guess that was the old norm, as people are saying, do open enrollment meetings at the city on site, but that's changed this year. So we're doing Zoom meetings or recorded in advance and then sending a link so that the employees and their dependents can review it and they can call and ask us any questions, however you would like us to handle that. We also provide ongoing assistance to the city staff if you have any billing problems, claim problems, employee contribution questions, just any type of service needed by the city and the employees. And it's ongoing assistance to the city and the spouses. So kind of how we did is we develop a timeline ahead of time and say, okay, we're going to start this do we know what your budget constraints are? And is everybody happy or not happy with the company that's currently insuring our clients, the city? And then we prepare a request for proposal. We distribute it to all the insurance companies. We then review the proposals when they come back to us, fully insured and self-funded if that's feasible and you have enough employees. We prepare the spreadsheet of comparison options for the city to review, and then we negotiate best pricing and we make recommendations, which I'll show you a few here as we go along. What happened?
Everything was okay for mine.
Oh, it does?
Yeah.
Oh, okay.
Me too.
Okay, there we go. So we prepare enrollment packets if desired. We can also, email that. We have an online portal that the employees enroll themselves that lists all the benefits, all the premiums, so they know, and it's real time. So when they enroll, it'll show, here's your plan, here's your cost, if any. We have that all put into our online enrollment system before open enrollment is set. We prepare a PowerPoint presentation to present to the employees either in person or through a go-to-meeting call. We assist after the meetings, like some people may say, I'm considering this HSA plan, but I don't know if it's good for me or if I should go on a copay plan. And so we sit and visit with them and explain, give them some direction of, well, pull your claims from last year, your EOBs, and we can help you figure out which plan would be best for you and why. Then we provide the city with the final enrollment and then the premium summary with any employee deductions. We can plan wellness fair for those clients that desire. And then we also have the old norm lunch and learn sessions. Hopefully someday that'll come back. So as I mentioned, we assist the city staff with anything that you need. These are just a few: eligibility, billing issues, billing reconciliation, if somebody terms, if somebody comes on, plan compliance, legislative updates. We review the plan's performance and let the person that is handling the employee benefits how the plan has performed. If there's any high claimant employee, they don't tell us who, they just say, hey, you've got a couple of high claims going on. We provide spreadsheets for payroll deductions. And as I said, we're able to assist the city with any issues and any questions you have. Spouses, employees call us, spouses call us. We help them also with the selection, as I mentioned, if they need, help finding a physician, on the list, or, where to go, urgent care clinics. We assist them with the insurance company website because it's got a lot of information on there, but it's difficult to find if you're not used to going to the insurance company's websites. Because there's one thing they have on there is like, check out the lowest cost for you to purchase your drug. If they're at the doctor's office and they're saying, hey, they're saying that I'm not enrolled in this plan, or, they can't find me, we're like, put the person on the phone at the doctor's office, we'll talk to them. Same thing happens at the pharmacy. Hey, I'm here at the pharmacy. They're saying that, I'm not in there, my drug is not covered, etc. We assist with that. There's just a lot of behind the scenes service in this business. And then of course, claims if someone is hospitalized and they receive, like 25 EOBs because you get one from the doctor, from the emergency room if you go there first, from the hospital, from the lab work, the radiologist. It just goes on, and it's very confusing. So we would tell them, look, put them all in an envelope, email them to us, and we'll go through them and tell you what you owe and what you don't owe. So here's just a few examples of our work from the city back to 2011, because that's kind of when you went from a small group to a mid-market group. So we helped transition the city to the mid-market area, which is over 50 employees. We assisted you all with the Affordable Health Care Act. Then we did our online enrollment portal in 2015, which I mentioned previously, that has all the employees and their dependents already pre-populated, and they can go in there and see what the cost of the plan is, if there's any deductions that are going to be taking place. Let's see. Then we enhanced in 2018. We
I had a slip of the hand, sorry.
In 2018, we added Cobra Administration, because you never want to, well, I guess you can if you have someone that's very knowledgeable, but Cobra is a federal law and there's stiff penalties. So we implemented a Cobra administrator for you all. Then in 2019, we added, we did some enhancements to your life and disability. And then after that, we implemented several plan options for you, because it was brought to our attention that, hey, I'd like to help the employees provide some monies for their dependents. And so we now have, I believe, 3 or 4 plans for you guys. 4 plans, okay. And then, mentioned before, the budget, you tell us what your budget is, and we bring all the options and make recommendations and give you reasons why, and we go from there. Does anybody have any questions before? Okay. Next slide. So here's just some of our references. If you wanted, to call someone personally, your best reference is going to be sitting in your chamber right now, April. I believe she's been there 4 to 5 years now, so she's had a good amount of dealing with our agency. Before that, it was Judy. Feel free to reach out to her if you wanted to ask her any questions. But these are some of the other municipalities we insure. And the the time frame that we give them. And that's our conclusion. Does anybody have any questions for us?
I would ask a question.
Yeah, we'll just stand by, we'll do some questions, and then when we're done, Shirley, will you be able to stick around in case there's any questions during the discussion?
Absolutely.
Okay. Paul, we'll start with you.
You had mentioned that you do, I guess you measure satisfaction from the employees here. How is that measured on a yearly basis? How do you measure that?
So, I mean, the employee calls and, asks questions or needs assistance. We just handle the situation. I think that we don't, there's so much, the service is so intense, it would be, you could do it, it would be difficult and take more time if we logged in every employee spouse call throughout the year. So my answer to that is, if they don't go back to April and say, I've called them, they haven't called me back, they said they would get back to me, but they haven't, that's the way you're gonna know if we're handling the employees' questions in a very timely manner. Barbie,
Can I chime in really quick?
Sure.
So I think what he's referring to is the bullet point that mentions plan performance. And what that meant was we look at the claims that came in versus the plan we selected and wasn't the best for that specific year, and how can we do better next year based on these claims, this ongoing condition, etc. So when we talk about plan performance, we're more talking numbers.
And as far as,
Go ahead.
just a second.
Go ahead.
I'm going to jump in on employee satisfaction. The best tool that we have, knowing whether your employees are satisfied with your plan, is the feedback we get from your HR department. And, if they're unhappy, they're telling HR, and I'm hearing it from HR if anything's going on that the employees are unhappy with. But, internally, you guys, just with, what you're hearing amongst your employees, that's the best information that we have. We don't do any kind of formal survey to measure employee satisfaction with their plan, if that's what you're discussing. However, we've never been, we could certainly do one if you want that to be done. Usually it's a situation, I know we had a situation in the past where a great example was, we went with Humana and we went with this open access HMO plan, and it was a total disaster, not because it was bad plan design, but because providers weren't familiar with that network and they were confusing it with the HMO in the individual market, and it was creating all kinds of havoc. And so what we did was we went back to Humana and said, that, this isn't working out. We need to move them to an NPOS plan immediately. We need to hold these rates for them. And so, that's what we did. So there's a lot of feedback back and forth between us and your clients. And I feel like I know so many of the employees personally. It's, they're not just your employees, but they've also kind of become friends. So that's kind of how we measure the satisfaction.
Did that answer your question?
Yes, thank you.
Anything else?
Rob?
Not right now.
Cynthia, any questions? Alan, any questions?
Pardon me, I have no questions.
No questions, thank you.
Okay, thanks, Shirley. Stand by.
Okay, can I jump just in
Do the
real
other
quick, Mayor?
presentation. Pardon me?
May I just have a couple of seconds, please?
You? Yes.
Yes.
Go ahead, Barbie.
So I just wanted to let you know, we let April know, I guess 2 weeks ago, but I have made a decision to move on. And I totally enjoyed working with the city. It's been a privilege and a pleasure working with everyone. but it's time for me to do something different. I'm going to jump back into the HR chair and run the benefits department for one organization. And so I'm kind of looking to slow down my pace a little bit because I got another 8 to 10 years to work before I can retire. And I'm not sure that I can swim fast enough to keep up with Shirley and Lauren and the crew. So it's been my pleasure working with Shirley and Lauren and Michelle and certainly working with the city of Helotes for the last 12 plus years. And I just want you guys to know that my leaving isn't going to impact you whatsoever. Everybody that works at the agency is a total professional. I think Shirley intends to have Michelle be the primary account manager taking over your account. She's excellent. You're going to love her. You'll just kind of wonder why Shirley didn't give you her to begin with, and I apologize for that. So anyway, wish you all well. It's been a great pleasure, and I just wanted to say that. Thanks.
Thank you,
Don't worry,
Barbie.
we're still gonna keep her on a side payroll.
And good luck to you. I understand you're going for the easy life at San Antonio River Authority.
Well, I'm hoping. I don't know what kind of landmines are awaiting me there, but hopefully it'll be a little bit slower pace.
I hear you're gonna have what you're probably not real familiar with, and that's regular hours. Anyway, good luck to you, and we've appreciated you and all the work that you've done for us through the years.
Thank you so much.
Okay, you have the next one ready to go? Y'all sit tight, we'll be back to you.
Okay, so we're waiting for this presentation to pop up. Lori, you're on top of that?
Working on it. It decided to start working right as I started it. So bear with me just a second.
Oh, virtual reality, isn't it lovely? Well, as Lori is finding our presentation, I will start by saying, my name is Jenny Haff, and I'm with Lori Rice here today, and we're with Marsh them. And, you all see us? There we go. Okay, good. And we're with Marsh Wortham, and I've been in the business, if you'll go to the next slide, Lori. I've been in the business for 25 years, and frankly have known Shirley and her team for that many years, and they are wonderful people. And so we also are friends outside of our industry, but it also happens sometimes that you go against friends in our industry. So that's happening today. So, and you're actually on my first, I have 5 children. I went to Texas A&M. I have a wonderful husband, and y'all are joining me on my first day of vacation today with all my children in the other room. It's vacation. But today I want to just walk you through some of our services, because I think it's important for you all to know. While Shirley has done an excellent job for you, there are some other agencies out there, and we were in this same position 5 years ago. Interestingly, it was down to the 2 of us, Shirley and myself, 5 years ago. And so here we are again. And with that, Lori, can you flip, or we have another?
Bear with me. It decided that I had everything ready to go, and then of course it quit. So it's coming back up. I was trying to be, prepared in time. So
No worries.
there we go.
Lovely. So if we can go to the next slide, I will go quickly through our services for y'all. We are a local broker here in San Antonio. As I mentioned earlier, I've been with the agency for 25 years, and interestingly, I've been with the exact same firm from the beginning out of A&M all the way till now. That was years ago, 25 years ago, and it used to be Helotes, Dennis, Ray, and Westheimer, then it became Wortham, and now back in 18, we were purchased by Marsh, which makes us Marsh Wortham. I'd like Lori, my partner, to go ahead and introduce herself and tell you a little bit about herself, because she's also been my friend in the industry. Lori knows all of the folks just as well as I do. And so, Lori, will you tell them a little bit about yourself?
Good evening, everybody. My name is Lori Rice, and I am with Marsh Wortham. I started out my career on the carrier side, and then I worked for a company, you might have heard of them, they're called United Healthcare. And then I went to the general agency side, which is a broker's broker, always knowing that I had to move to the broker side. And then I went on to the HR side. I have my professional human resources designation, and then moved to the employee benefit side because that's where I'm the most comfortable. But I've been in the insurance industry for 30 years, self-insured certified, so I do fully insured, self-insured. I have a professional human resources designation, small group certified as well, and I'm also at my property and casualty license. You know, I wanted to make sure I could encompass all sides of the industry. So, and have known Jenny and the folks in her office for, well, her entire career, Jenny. So that's just a little bit about my experience with the insurance industry.
Okay, so let's move into our Marsh Wortham spectrum of services. And before I do that, just so you all know, Marsh Wortham, as I mentioned, Wortham purchased us up in 2018, but it hasn't really changed. The fact that we're a public company hasn't really changed how we operate in San Antonio, Texas. MMC, or Marshall Planning Companies, is our umbrella company. And more than anything, it's just offered more resources for us. And under that umbrella, it's been wonderful to see the resources available on the employee benefits side. So we've embraced this, and so it's just made us stronger. The next slide shows our whole spectrum of services. And if you go clockwise around this is where we start. And I'm going to, if you don't refer to anything tonight, really you can refer back to, because I'm going to touch on each of these quickly for your benefit. And then on each of the slides following, we'll dig a little deeper into each of these. But in regards to account management, we feel that when you're planning and strategizing and trying to get together all the different vendors, our tenure in the industry matters. It allows for negotiations with these different carriers on your behalf. And so our excellent relationship with all the carriers, because we've all been in the industry so long, that really behooves our clients. Employee engagement. We shine here because we believe in one-on-one counseling. We believe that we want to open enrollment meetings when life gets back to normal. That's how we typically do it. We want to be a teacher. We want to teach your employees about their benefits. You all spend a lot of money on their benefits, and we want them to understand exactly how to use them, because time and time again, people leave and they go, now, tell me what a deductible is. And so we have one-on-one counseling. We want to get to know your employees year to year. This is a unique year. We're doing Zoom meetings, and it's been, like this. We'll sit in a room, and I've done 6 meetings in a day with 20 people on the line, and we just get through the employee booklets that we put together for you. As we move to market data and insight, some of the that we have now through Marsh Wortham, we have the capability to do benchmarking. And so we also I personally handle 4 other cities, local cities that you guys would be familiar with: Hondo, Kirby, Hilltree Village, Hollywood Park, and I have for years. But benchmarking is important. You may want to know not only citywide, statewide, or even globally, how cities are managing their employee benefits package. What are they standardly contributing to medical or dental or vision? So we have capabilities through Marsh to benchmark on your behalf, and we would propose those to you and let you contemplate those. But those are just upon request, so we're happy to do benchmarking for you throughout the year. In regards to wellness, we could sit here for hours and talk about wellness. As you all know, it's from wellness light to wellness heavy. And so frankly, in this conversation today, I've put that on the back burner because I have designed many wellness plans in my career, as has Lori. And that is another conversation that we would have. And it's a full hour of where do we start, how can we do it, what's our budget look like, how do we engage the employees, and so have that at a separate time. But we would understand what your expectations are and help you with your wellness initiatives. Customer service is key. We want to be there for your employees. We have an entire dedicated service team. You're only seeing myself and Lori on the call today, but we have locally in our Marsh office, we have 125 employees, but in benefits, we have 30. And so Lori and I are 2 of the 30 that are on the benefits side, and we have a whole customer service team that manages any kind of that come in. Lori, your key senior account executive, so your key point of contact, and the 2 of us work collaboratively on your group to make sure it goes smoothly throughout the year. And then compliance. So compliance is a necessary evil. We all don't like it, but we all have to do it. It's an employer responsibility, and so we help you manage that, and I'll go into more detail about our HR resources available for compliance. Next slide. And now allow me, if you don't mind, just to dive into each of these little services a bit deeper. So we don't like surprises, and you all don't either. So we start the renewal strategy 90 to 120 days before your renewal. And throughout the year, we're meeting with you. So, and pretty much clients dictate that. It could be a semi-annual review. It could be quarterly. It could be monthly. And what we do is we set up a timeline at the very beginning, and then we stick to that. And so we know that we'll be reviewing claims with you throughout the year. And then there are no surprises when your renewal comes. And we'll be backing to when you want your open enrollment meetings. And we'll make sure that we meet and present to you. We know, especially with cities, you all have city council meetings, you have budget meetings, and typically with my cities, we back into those days, right? So we know exactly when your council meetings are, we'll be on the agenda so that we can present, and then we back that. But throughout the year, you'll be very familiar with us. Again, you'll dictate how often you want to see us, but we will shop and negotiate on your behalf. And as I mentioned, being experienced in our industry is very helpful. Next slide. So as your insurance agents, you know, we're really your consultants of risk, because there are so many different options available to you all, and I promise I won't go through this entire slide, but what this shows is a spectrum of risk, and whether it's for fully insured or self-funded, how much the spectrum suite of options that are available to you as a city, we understand them and we know them well, and these are all the different types of things that are available, whether it's network or plan design. And so this is just a snapshot of what that looks like. And so we'll be able to, as if we were chosen as your agent, we'll walk you through this and more than anything, help you understand what options are available to the city, where you can save money, how much transition issues do you want to have with network transition and things like that. So we'll help you understand that full spectrum, and then we'll all make a decision together on what makes the most sense for you and your employee. Next slide. So employee engagement, as I mentioned earlier, is the key too, because we need them to understand you all have a significant premium commitment that you're contributing for them. And so we want them to use their plan, want them to understand it. So we typically do the online enrollments with Employee Navigate. I understand is your existing admin system. We have the same one at Marshwortham. And so your employees would be familiar with just switching over from one. It's the same system, so be familiar with looking at Employee Navigator. You can enroll online, which would be nice. And then we do personalized booklets. So it would put the city of Helotes, it will have your logo on it. You can choose pictures if you'd like. We can customize it to whatever you'd like, and we print up all these very nice booklets for everyone, and we'll distribute those. And then, like this year, then we would go through those booklets with everyone in the room and walk them through it, and then have, if anybody had questions or concerns, they could call Lori or myself or our entire team if they had questions on even enrolling in the system, because all of our team knows how to help them enroll. But it's a teacher-student type of situation, because again, we are teaching them and educating them on their insurance. Next slide. As I mentioned, these days compliance is key. You know, it's an employer responsibility, but what is difficult about it is it changes a lot. So our resources at Marshwortham are such that we keep you updated. Not only if we become your agent, we will come in and audit to see what you have in place, because the worst thing that could happen is you ever had an audit and you figured out you didn't have what you needed in place, okay? So from plan documents and summary plan descriptions, all your section 125 documents in place. We actually put together a notebook for you, and so it's easily accessible. You turn around, you grab the notebook in case you have to update it, and every year we help you update it. But we'll find where you are today with that audit, and then we'll take you forward. We have resources if you're interested in employee handbooks. So if that's something you all haven't touched on and you've been meaning to do it for years and you haven't, we have an entire HR team that help with, it's more of a partner with Guardian HR that will help with putting together employee booklets. Excuse me. So the compliance piece of it, we've got that down. And again, you don't have to know everything. We just need to, once we go through the audit, we'll keep you up to speed on all of that, because it's a lot, and especially it just seems like it gets more complex year to year for all my HR folks, and so you'll appreciate that we hold your hand through that. On the next slide, you'll see that part of that is helping you with throughout the year. We have webinars, we have seminars. Most recently, we've had one pretty much every, especially when COVID all happened, we were sending out publications every single week to help people understand with Trump's COVID-19 federal guidelines on what kind of Q&A have with furloughs and state mandates and temporary layoffs. And I know that you may or may not have had a lot of that, but it was difficult for a lot of folks on how to handle that. But unemployment benefits and things of that nature, there's always things that come up. And so our resources allow us to give you a helpline and an email through our partner called Benefit Comply, and they do a fabulous job. You can email them anytime, and you know, with HR or even with whatever you're in, there's always some key things that happen in HR. And so you can send any type of question and they'll reply to you within 24 hours. And that's through our Guardian Benefit Comply partnership. If you switch the page, Lori, we'll go on to the online resources for your HR team. So these, as mentioned in the prior slide, there are so many. Unfortunately, we don't sell just insurance anymore. I mean, back when we started in 1995, that's all we did is we were selling $99 employee-only rates. Remember that for crew care and all of these wonderful things? That is no longer, folks. Employee benefits is expensive, group insurance is expensive, and now HR person, they have to deal with a lot. So it's employee benefits, it's payroll, it's HR, it's compliance, and all of those things somehow became part of our jobs. And so Lori and I now, we know about these things, and we're able to give those resources to our clients as well. So some of these topics that you see listed there are things that happen all the time. Are they insurance related? Not necessarily, but are they employee relations related? Yes, and we help you with that. Next slide. As I mentioned in the beginning, we don't like surprises, and I know you don't like surprises. So we are pretty diligent about starting as quickly as we can, especially with our, if we back into that timeline. And so, this sample timeline, this is just a sample, clearly, but we would sit down with April if we were to receive your the AOR, the agent of record on your account. We would sit down with her and understand her expectations and then talk her through some of the things that we need and some of the things she needs, and we outline it so that everybody's on everybody's page and we all know what's happening. And so that's all about communication, which is what Morgan and I, we feel like with our clients, they call us all the time. We appreciate that. We want them. And frankly, we get to know all of your employees. So they also call us as well. Because even just as mentioned earlier, insurance is complex. And so people get frustrated, it's emotional. And that's why we're really good at our jobs, is because we understand that we're the people's people. And so we get involved. And so we're making recommendations to you as the city from a financial standpoint, certainly. I will be for city council meetings to make recommendations, after I met with your staff, to make recommendations every year. And then throughout the year, we're going to carry your folks through the plan that we all select. So with that, we'll see if you all have any questions for me.
Okay, thank you, Jenny. Did I understand you to say you've been out at A&M for 25 years?
I have. I've been with the same company for 25 years.
Well, Diego, I got you beat though. I've been out for 53 years.
Okay, you beat me.
Anybody have any questions?
Yes, sir.
Okay, we'll start with Councilmember Byes. He has a question for you.
Yeah, Jenny, under the employee engagement and advocacy slide, what is under employee materials? You have the election confirmation statements. What is, I'm sorry, I don't know what that is.
Oh, an election confirmation statement, so.
What?
An election confirmation statement allows the employee to understand exactly what they elected. Sometimes they look at all of the employee booklet and it shows the premium, and so, but they're not sure like how it all tabulates, right? So at the end of your enrollment, we will have medical, dental, vision, accidental, other disability, whatever coverages they elect, and at the bottom it'll get all up for them.
Okay, thank you.
That can be generated out of Employee Navigator.
Anybody else have any questions?
I have a question.
Alex, go ahead.
Thank you. This is to either of you. Given that you're not the city's existing service provider, and given that this timeline starts in the March-April time period, and we are already well into July, how would you approach a transition and get us ready for this budget season if you were indeed selected?
Okay, I think
Yes, that's correct.
Yes, okay, good. So we have to kick it into gear, folks, because we have, most of our cities, are already done. Meaning we've already negotiated their renewals. And so I would say that if we became your agent of record, they submit the letter straight to the carriers. We would have to hurry up and get busy and make sure that we get it out to bid as quickly as possible to see if first of all, we'd like to look at the renewal and see what they're offering your existing carrier. And then if necessary, we would put it out to bid. Sometimes we're able to negotiate on your behalf based on your claims. For instance, 2 of my cities this year, we have negotiated rate passes. So on 2 of our cities coming up 10-1, they have no rate increases at all. Now, can I promise that for you all? I can't, because I haven't even, looked under the hood. But I will tell you that we have already put 2 of those 10-1s, already have made decisions, and now we're just enrolling. So we would need to hurry and get going on it, but I feel quite confident that we can make that happen prior to 10-1.
Great, thank you.
Alan?
Jenny, you may have already addressed this, and if you have, forgive me. What other cities in the San Antonio area do you provide services for relative to the size of Helotes?
So we have 4 cities that we currently handle the benefits for, and City of Hondo has 105 employees, and we've handled them since 2017. I have Town of Hollywood Park, they have 60 employees. We've handled them for 11 years. City of Kirby is 50 employees. We've had them for 18 years. And Hill Country Village is 20 employees, and we've had them also for 18 years.
Thank you.
You're welcome.
Anything else, Alan?
I believe that's it.
Cynthia? Paul?
On this slide that you gave us, it says our employee benefit services. This is all part of the package. This isn't extra cost. These are all just part of the services that you provide as our agent of record. The wellness stuff, that's all part of the service.
Right. Correct, sir. So we're compensated through the carriers, and so we take standard commissions through the carriers.
The administrative services that you're receiving for Cobra and Section 125 and things of that nature, that's all paid independently through the Cobra and 125 vendors. So, but the insurance placement of products, those and all these services listed here, that we're compensated through the carriers, so that pays for that. But any of the administrative services, that would just continue on with your existing administrative service vendors, and so we don't pick up those costs, those would just continue on. But everything listed on our spectrum of services are things we typically do.
Thank you.
You're welcome.
I didn't catch the middle 2 cities. You said Conroe at first, and then the only suburban city in Bexar County is Hill Country Village that you serve. What were the other 2?
It was Hondo, H-O-N-D-O, not Conroe, but it's Hondo,
okay. Mm-hmm.
Park, Kirby, and Hill Country.
Okay, very good. Okay, that's all the questions. Then we need a motion and a second to get into discussion and knock this thing around and see if you can make your decision tonight. So we have a motion and a second.
Mayor, I'll make a motion to discuss, take action on 10.
We have a motion from Buys. Do we have a second?
I'll second that.
Okay. Bert, it's your discussion.
Well, I think they're both very qualified companies, but they're going to be working with April and Marion quite a bit, and I'd really like to hear what their views on the 2 firms are.
Do you have any specific questions or just a summary?
I would just like to because they did the interview process, and I would just like to know how they feel about the 2 companies. I mean, that's, to me, they're going to be working with these people.
They'll be working with April quite a bit. So April,
yes.
Go ahead.
Hi, Good afternoon, or good evening, council. So you're correct, we interviewed these two firms. I do think that they're very comparable in what they can provide for us benefits wise. And they both have experience with firms that are the same size as us. In terms of how I feel about them, we've been with Crandall for a long time. They have amazing service. They're great. They work with the employees. With Marsh, I believe that they have the same level of service. However, I do think that they have additional services to offer us that I'm intrigued about because they have specific HR tools, and I'm a department of one. So it's good to have more tools for me to have on hand if I have specific employee instances like happening. So, is that answering your question?
Yes, so what I'm hearing is you would prefer Marsh.
Yes.
Okay.
Alex?
Thank you, Mr. Mayor. I had a similar question, and I think I've looked at that as an option. As I look at the individual information that's presented to us from the interview, selections, and scoring, I think that's the case. I was intrigued in comparing in my mind the two in many ways, and I have my thoughts on that, but I don't have any questions for April this time. Thank you.
Alan?
April, I noticed that we have yet a third vendor that was highlighted as far as their overall score was concerned. That's Cato or Cato.
Yes, sir.
Did they submit a proposal?
They did. So they were one of the 8 that submitted. The highlighted ones were the 3. We did do interviews with all 3 of them. However, after the interviews were concluded, we came down between Crandall and Marsh with them.
Okay.
And that's just in terms of how we felt they're going to meet our service and our needs as a city like us.
Very good, thanks.
Was one of the points on Cato and Cato that they were fee-based rather than commission, or am I wrong on that?
No, actually, they work both ways. They would do it either way, which is irrelevant, honestly, to that. Just in terms of service that I would be able to get personally, I felt it would be better from the other 2 just because they're a little bit smaller and they can handle everything with Cato and Cato's compartmentalized, I guess, and at both Crandall and Marsh, their account executives, they do everything about your plan, like from the knowledge about getting the quotes all the way to helping the employees with their claims, which I personally like to have one person I can kind of talk to about all aspects of our plan.
You're saying that's with Marsh?
Both Crandall and Marsh.
Both Crandall and Marsh, yeah.
Yeah.
Okay. Cynthia?
Yeah, this is difficult because Crandall and Associates has been with us for a long time and has done a good job. I did like Marsh Wortham's presentation. I like the extra things also that they would do. So, you know, and then what you're telling me, I have to tell you that, like I said, it's very difficult to move from an entity that's been doing a good job for a long time, but I've been leaning towards Marsh because of the presentation and the things that they can offer. And sometimes it's just good to have, after a long time, you know, some new things, new thoughts.
Paul? Paul?
Looking at the scorecard, I mean, they're really neck and neck. But I guess in y'all's opinion, Marsh could provide those additional services that would be beneficial, the compliance and stuff, that really could be a benefit to the city. Is that why they scored just a little bit higher on that scorecard?
Yeah.
Just that little bit of help that a one-man operation could use.
Yeah, having the additional resources and that they offer us, but they also have additional resources themselves. And so, like I said, I feel the service to meet the service for our insurance, same thing, just they have additional resources that come at no cost to us.
And you're satisfied with the business we've gotten and the service we've gotten from Crandall? No complaints really about that?
No complaints, yeah, Barbie has been, well, she was our account manager, she was wonderful since then.
That's all for now.
Okay, Bert, anything else?
No.
Alex?
Just one follow-up question. Do you believe that from what you've seen that the technological services provided are going to be comparable, meaning like the hours and the online service and all that, or do you think that, and I keep thinking of Marsh as being a part of a national group that might have a better backup system, and I don't know much on whether Crandall does or doesn't, but I was wondering if that came into play as well.
So in terms of the technology that our employees would use, it's the same exact platform.
Okay.
So it would be a seamless, either way, like they're the same, it's the same exact platform. It's exactly what I've been looking at day to day. In terms, I guess, of availability of service, I don't think there would be a change. The only difference with availability of service to the employees is Marsh or Crandall. I just deal with our account executive and they'll do everything and it's great. Marsh has actually a customer service team, like a whole center that the employees would have a number to and they could call in to get their issue taken care of. So I guess in terms of availability of service, that's the only thing that's different, but their online platforms are the exact same in the way of design.
Well, I think considering that you serve our employees and serving you is a very important part, because if you don't get what you need on an immediate basis, then it will hinder what our employees will get too. So, thank you.
Alan?
I don't envy the person who has to make this decision, Mr. Mayor, because I found, I'm sorry.
Sorry, I came to y'all today for you to make a decision.
I found the presentations both very good. If I had to lean toward one over the other, I would lean toward Marsh because basically based solely on the presentation. Now, as far as their qualifications and the quality of service they provide, that would be your call. But just on the surface, Marsh made a better presentation in my opinion.
Cynthia, anything?
This is a one-year contract?
Last 3, isn't it?
No, we presented it with a 3, but well, both carriers, we have the right to terminate within 60 days of the contract ending, even if it's within the 3 years. So we would initially set it for.
Typically, it's been 5, but we can negotiate any term.
Yeah, well, I was gonna say, you know, I'm not sure why we want to do 5, we can do 3 to start off
And they can be terminated at any time for any reason.
Yeah.
They can be in the contract. Paul, anything?
I don't think so.
Well, I'd like to just make a few comments, just from my perspective. To me, the experience with Crandall outweighs the presentations from the Marsh group. When you're dealing with something like this, the 25 years experience that we have, I don't feel that necessarily that needs to change because in the 13 years I've worked with them, I don't work on a day-to-day basis with Shirley or Barbie, but they've always been accessible. They've always been very responsive. I'm not aware of any serious complaints other than your typical day-to-day complaints that people might have about, a prescription or something like that. But there have been no service complaints from any employees that I'm aware of over that 13-year period. The responsiveness should count for a lot in me, in my opinion, and also they're always very thorough. And I can tell you, if you remember the slide that Shirley went over, they have been very innovative through the years with a lot of new programs for us. They've given us some great options. They've always gone to bat with the providers and gotten us, I've always felt, some very good deals on premiums year to year. and have kept us from escalating quite a bit. And I know from experience going to meetings with TML and talking to other people about these kinds of things, we have one of the best benefit packages, including the health and the other insurances of many cities out there. I appreciate what April is saying, but you know, you can't really tell a whole lot in short interviews, especially with a large, very large company like Marsh's, evidently, since they acquired the local company. I just hate to see a decision like this made based upon the presentation and discounting 25 years of faithful service on the part of Shirley Crandall and her group. They are a team. Sometimes, and most of the time in my mind, smaller is better. In something like this, when you do get a very personal service. And we have had our own account representative, which was Barbie, and she's always done an excellent job, and I'm sure that Michelle and Lauren would do the same thing. What I would like to have the ability to do is bring Shirley back and maybe have a response to some of these little perks that seem to be catching y'all's eyes, because to me they're pretty standard stuff between the two, except maybe for some of the webinars, but let's just see how much weight that would carry if they have the same ability and just didn't mention it tonight. And I don't know how much demand there would be, even with April with the HR assistance. There's always other things that we can do to subscribe to information sources to get questions answered on HR stuff. So, y'all have any? I'd like to go back through and let y'all respond to what I'm saying. But I do think that the 25 years shouldn't be discounted just offhand because of a nice presentation by Marsh. But you have any objection to bringing Shirley back to maybe answer some questions about these technological advantages of Marsh? No. Can you bring Shirley back?
She's the one.
Hello.
Hey Shirley, I'm assuming you listened to all of that. I was just curious, the page that seems to be bringing up some questions here is this helpline to attorneys and regulatory analysts who can quickly answer complicated compliance questions and HR things. Do you have access to that kind of thing where if April does have an HR question that you could help her find the answers that she needs?
Yes, we actually have a partnership with a HR company that if we had any questions, if April had any questions, we could come do an on-site meeting with her. We could do a phone call with her. So while we don't have on staff attorneys and HR consultants in this business, as Jenny mentioned, it's more complicated now than before when you first started just selling employee benefits. And so HR, compliance, we do account management, employee engagement. We're definitely, all about that. You could ask your employees or April. We can provide you with some market data if you would like that, with the benchmarking. We have wellness programs. We always encourage the employees to do that so that they can hopefully stay healthy and lower the premiums. We have compliance also. So we have access to all those services, and those won't be additional to the city either. I tend to focus on the employee benefits part just because that's what I feel is the big budget ticket, but we're here to help you any way we can. And yes, being in the business 33 years, we have numerous partnerships and contacts to assist with whatever you would like us to, or April would like us to.
Well, I remember early on, Barbie had explained all of that you do have those consultants, for lack of a better word, or associates that you deal with on those kinds of things and make them available to us. As far as the election confirmation statements, that's all pretty typical, just a package that each employee gets upon the enrollment, is that correct?
Yes, sir.
Go ahead, Barbie.
We use the same benefit enrollment system that Marsh does. It's called Employee Navigator. We can print off benefit confirmation statements, individually by employee, or we can print them off like all employees and send them out. So, the employee, when they get to the end of the enrollment process, they see a summary that tells them exactly what their total cost is per payroll. So again, we're using the same enrollment platform, so whatever access they have with that enrollment platform, we have with ours as well. One of the things I did want to mention is, somebody asked a question about the timeline and about how pressed are you going to be, and Jenny mentioned that you're really going to have to get going on this if you choose Marsh. So one of the things I'd like to tell you is that it would have been very easy for me, as I'm in my last days at Crandall, to just wipe my hands of this and say, well, I'll just let Lauren and Michelle work on this if we get selected. I felt very confident in Crandall, and I felt very confident that we would be selected. So I did already attempt to negotiate with your insurance carrier. In my discussions with them, they felt it would be best to have competitive data. So almost 2 weeks ago, I sent out the RFP. It's not going to inhibit, if we're not selected, it's not going to inhibit anybody else from getting quotes. But I just wanted you to know that I've already sent the RFP out with a deadline for those quotes to be in my office by tomorrow. I've already received several. Gone out looking at many different medical options, from fully insured to level funded to self-funded options, also to TML. So a lot of the work's already done. I'm just hoping that it wasn't done today.
So y'all are confident that even though it's this late in the year, you would be able to go ahead and complete everything as well as anybody else?
Actually, I think we can do it in more timely than anybody else, because we're already 2 weeks ahead in the process.
Okay.
And we did this because honestly, it's kind of like what the mayor said. We care about our clients. You're not just a client to us. You're not just money to us. We sat down as a team and we said, okay, what do we think is in the best interest of the client? Even though that's work that we've done that possibly we won't be selected, but we all agreed it's in the best interest of the client, because as Jenny mentioned, we've already renewed our cities also. And so we didn't feel it was fair to you or our long-standing partnership to leave you hanging and like starting from scratch now. So we really did it for the city so that, you won't be behind the 8 ball.
Okay, well, we appreciate that. And again, whatever happens tonight, we appreciate your 25 years of service to the city of Helotes and the hard work you do each year for us.
Thank you.
Okay, that's pretty much all I have to say. I like dedication and allegiance and small companies working with us, but that's my opinion. You guys are the ones that need to decide. So with those comments, anything that you guys have to respond to my thoughts?
I have a question. If, knowing that we're in this time constraint, why were we not given this information about 2 or 3 months ago?
Marion discovered the expiration date on the contract. I wasn't even aware of it until she mentioned it and had already put out the RFQs.
Right, I realized that it was expiring when I didn't realize it was expiring on June, it actually already expired. So they're working.
Without a contract.
Yeah, without a contract. But what happened is as soon as I found out, I got an RFP out, we have to post it for 30 days. You have to do that. So we had to do that. We had 8, which we had never gotten before. Prior to that, I believe in the previous years, we got 3, maybe 4, the last 5 years ago. So we had 8 people actually apply. So the evaluation committee went through that. I was not part of that evaluation committee. I had excused myself because I knew one of the 8 that were listed was owned by a personal friend of mine. So I could not be on that one. Once they narrowed it down and it wasn't one of it wasn't that company, then I came into the interview process.
So will this new contract be backdated to June 1st? Or is it, because if it is, then we're gonna be in the same situation again.
No,
Now we're going to the end of July or August the 1st for the next contract, which is not a good time period for us to make a decision. Because
Right.
this is when, right? I mean,
Well, what we would do is probably at that point, if we put an RFP out, what you usually do with contracts like that, so I don't know why it came in June before, 5 years ago or so forth. What we would do is, put out an RFP, have everybody apply for it, and then if whoever we pick tonight is not, a part of the selection, then you have that termination clause, that you can terminate the contract prior to that, and we'll do that so we can start a new contract with the next one.
I also understand that you don't necessarily have to go out for proposals, that if the company that you're using is doing a good job, you can just go ahead and continue using them, but I wasn't able to confirm that. But I do know other cities do it that way. And I was disappointed too that I didn't have a chance to look at this any closer initially, but leave it up to Marion and April. The only thing that, again, I stress is don't discount 25 years of faithful service initiative where Shirley and her crew have always brought innovative ideas to us. And I don't believe there's anything that Marsh offers that Crandall doesn't already offer if they're asked to do it. Anyway, you know where I stand, so you guys are the ones that make the decision. Just don't discount 25 years. Bert, you were up first. You got any comments?
Okay, can April come back up again?
Sure. You guys have all the information you can.
Okay, April, do you still feel the same way about Marsh? Because you're going to be the one working with them.
I do.
You do?
Yeah.
Okay.
Like I said.
I don't, I know it's a short time frame, but I think they can still do it. And since I'm going to have to go with our employees' thoughts on this, she's the one that's going to be working with these people. Even the mayor said that he doesn't deal with them every day. She does. And I'm going to have to go with my employees' thoughts on this. I mean, I understand 25 years, yes, but sometimes change is good.
Alex?
Mr. Mayor, I'm torn actually. I guess my only question would be, we're talking about an employee benefits plan, and if it's for the entirety of the employees, and you told us multiple times that essentially the employees will receive no difference in service from one company versus the other. That the only difference that you've noticed is that your support from an HR perspective might be slightly different with Marsh Wortham than that. But in the entirety of the vast majority of the contact that the company we select will have with the everyday employee, you're telling us is really not going to be any difference in that. And both of them have long-term business contacts and can do comparable competitive searches on behalf of the city. So I don't know. So essentially the difference that makes it for you is the support you yourself might receive from an HR management perspective, not so much that the employees might receive from a benefits perspective. Is that correct?
Correct.
Thank you.
But Crandall also has those resources.
Yes, I get that, and that's what I'm trying to get in my mind, because as a manager in a large company, I get the need for being able to bounce off ideas on others, especially in the complex compliance requirement of HR. And while I have a degree in HR, it's from a longer time ago than these folks, and I don't get to practice it on a daily basis, but I understand that from a daily working with employees and having resources where I work that are doing that. I'm just wondering if that should be the deciding factor when there might be other available options for HR help.
And there's a lot of that out there, and I talked to April about that, if, I don't know what frequency she would have to use those little perks, but there's always other sources.
That was my ramblings, thank you.
Okay, Alan?
You'll have to forgive me, I misread agenda item number 10. I thought we were voting to give you authorization to make that decision.
To negotiate the contract.
Yeah, okay,
You guys make the selection.
I understand that now. I was impressed with Crandall's statement that they've already started work on our proposal and started getting quotes. That's impressive. So I'm more torn than ever now. So it's a tough one. I'm going to think in the next 5 seconds to make up my mind.
It just shows you the initiative I was talking about and the dedication to us as a city and a client. Cynthia?
I'm on the same boat. I'm in the same boat as Alvin. I am very impressed with their initiative. They don't have a contract in yet. They put out the request for proposals because they know our budget season is here and we're working on that. And that is very impressive. And they have done a good job. So I guess my thought again is on what Alex was talking about, the HR part of it, that you're a one-man show, and so that was something that you need. And so do you think that you can work with Crandall to find other kind of HR help? I mean, what is the help that you're really looking for?
Well, the thing that Marsh offers, so it's a compliance website basically that has HR professionals on it. So I can just get on if I have an issue and reach out to somebody, as opposed to sometimes I have to actually reach out to our city attorneys on things, which costs us money, so I try not to reach out to the attorneys. So that's nice. To answer your question in short, yes, I can work with Crandall to do that. I mean, I've been doing that already for 4 years. It's just nice to have something kind of at your fingertips, ready to go. And
they don't have that.
No.
She said that they could. They have a consultant.
They do, and there are other things. I didn't talk to April about this until today, but there are other sources that we can explore. So I would not make the decision based upon an online HR question and answer perk, if it was me. Paul?
It's almost a wash, and there's no financial disparity between the two because they both work off of commission, so it doesn't cost us any money. And they work tight, both of them were within just a few points. And on the service side, they were only a point difference. I'm torn, I could go either way.
Okay.
It's a definite maybe.
I'm nervous.
You got a quarter?
But we need to go around and knock this around anymore. Again, you know where I stand. I believe in staying with the people. If what we have isn't broke, and we've been very successful for 25 years, I don't see a need to change. And that's just going to continue to be my pitch. I don't work with them on a day-to-day basis, but I have worked with them each year. It's to some extent. I've always been impressed with their organization, and again, I like the small team, and I know that they're going to do an excellent job for us going forward. So that's I'm going to keep saying that. But and when we can get April all the help she needs for HR questions when and if she has them, I have no doubt about that, and it would be an insignificant cost.
So, Mr. Mayor, I have a question. Since we have a motion to discuss and take action, but not as to what that action is.
Let's make the selection.
Right, but we still have to decide how you're gonna do that in a way of a vote, right? Or so
Yeah.
since Bert
Yeah.
made the motion, I don't know if he's ready to throw one name out there, and then if we vote in favor, we select that one. If we vote against, we automatically select the other, or do we need another motion?
Good question.
Or do we go around the room and each say one word, and then make the motion following that?
Well, it's up to you guys. But we could get a consensus, I suppose, and see how it goes, and then make the motion, amended motion to include that company. That's sort of how we've done it with other things. From a parliamentary standpoint, I suppose, well, either one would work. If Bert would like to make his selection and make that into an amended motion, then you'd vote on it, and it would either be a vote for or a vote against. And so if you vote no for his selection, that would be a yes vote for the other one.
Okay,
That makes
I'll
sense.
make the motion.
Does that sound fair enough?
Yeah, I would think that a second motion would be in order,
Well, we can do that.
affirming a particular vote
Yeah,
versus,
yeah.
rather than default to something.
Right. So what we'll do is Bert can amend his motion with his selection or his recommendation of which way you go, and then we'll vote on it. And if you all vote yes for whatever his choice is, then it's a done deal. If we have more nay votes, then we would make another motion for the other company. Sounds like a workable plan. So Bert, you want to amend your motion to select one or the other?
Yes, I'd like to amend my motion to select Marsh Wortham as our employee benefit service.
Okay, and the second on that was who?
That was me.
You second that? Okay, the motion then is for the new insurance broker to be Marsh Wortham. So that being said, any discussion other than that? We'll call the question. All in favor of Marsh Wortham, say aye. All opposed, say no.
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 Okay, so that motion is defeated, 3-2.
Who said no?
We had 2 ayes.
Okay.
That was you, right?
Yeah.
Yeah, Cynthia and Bert,
Okay.
and 3 nays, Paul, Alan, and Alex. So would someone like to make an amended motion for Crandall and Associates?
Mr. Mayor, I move that on item number 10, we authorize you to negotiate a contract with Crandall Associates.
We have a second?
Second.
Okay, we have a second, he beat you to it. We have a motion from Blue and a second from Holmes to authorize me to negotiate a contract with Crandall and Associates. So again, we'll call the question. All in favor, say aye.
Aye.
Opposed, say no.
No.
Nay. We have 3-2, the same but in reverse. Okay, well, I appreciate it. Shirley, congratulations. If you're still there. If not, I'll tell you tomorrow.
I'm still here. I'm trying to get my camera on.
Okay, congratulations. You've been selected, and Marion and April and I will be getting with you on the contract, and keep on working.
Thank you very much, and I hope April will be pleasantly surprised at the additional services that we can bring to the city and the employees and to her for HR and any kind of other assistance she may need.
Thank you, Shirley. Have a good evening.
Thank you. You all.
Okay.
Thank you, Jenny.
Huh?
Thank you, Jenny.
Yeah. And Jenna, thank you for your efforts. That was a good presentation, and we appreciate you participating.
They left already.
Jenny, you still there?
I think she left.
Okay. Okay, well, that finishes up our agenda, so I would, there are no objections, we'll adjourn. Any objections to adjourning? Okay, we're adjourned at 8:50.
I'll just go around there. We may change our mind yet again.
Before y'all leave, can I have one